I am so excited to have on the show today Dr. Jade Williams. Dr. Jade Williams is a world renowned neurologist who specializes in looking at the stroke epidemic in Black and Brown communities. But he's also been spending the past few months working on the front lines. The interview you're about to see today, although Dr. Williams is incredible, I am sad that I am meeting with him under these circumstances. With that being said, what he shares today, I think, will be incredibly helpful to anyone dealing with this traumatic situation, either firsthand or vicariously.
I need you to know that I was looking for.
I'm so excited to have you on the show. If you could please tell people watching a little bit about who you are and what do you do?
I'm just a regular guy, family man. I'm a professor of neurology at Columbia. I'm also the chief of staff at the Department of Neurology at Columbia. I spend a lot of time, thinking about how I could be useful to my community, how I could be useful to my colleagues, to the world. I always thinking about how I could make my environment a better place. I come from the belief that if you can change one life, that is the definition of success. If you can impact one life, that is the definition of a life that's been lived well. Because I've always said this, that success is not defined by the size or the scope of our accomplishments. It's defined by our ability to hear the cry of a single heart and respond to it. And that's really how I live.
The field of medicine is so vast and broad, and I feel like the more you learn and study about it, the more there is to unpack. What made you decide on neurology, or did neurology more so choose you?
Neurology chose me. So many times in our lives, the universe chooses us or selects us for a specific profession, mission, goal, objective. There's a lot of serendipity that's encountered on the walk of life. And I have certainly not been a stranger to it. Some people believe in luck, but I believe that luck is sometimes powered by a higher power. I believe that sometimes luck is powered by the universe. I believe that sometimes luck is powered by the favor of a higher power. I think it's important to recognize that you are fortunate when the favor lands on your life. And I think it's important to make sure that you approach it with humility and hard work. I truly believe that we don't count our small mercies. We don't count our little blessings. And we're always chasing the big, flashy goals. We don't realize that it's the small gifts, the tiny mercies, the pieces of grace that are scattered around the pathways of our lives. I think it's being able to stop and recognize these small mercies, these small expression of grace and favor. If we're able to recognize those small things, the cumulative effect of all those small mercies is what really is expressed in greatness. When a great painting is completed, it always begins with a small brushstroke at the corner of the canvas. When a great athlete wins a medal, it always begins with those lonely hours of training when no one is watching. It's in these small moments that I believe true power is found. I believe that we can access the soul of the universe through these small moments.
What exactly is COVID-19 for people who might be curious, and what your experience has been like fighting this pandemic as opposed to other things that you might have seen in the past?
COVID-19, it really stands for, the CO is corona, the VI is virus, and the D is disease. And 19 is 2019, which is when the virus was discovered. That is what COVID-19 actually stands for, coronavirus 2019. It's a member of the family of coronavirus. There's actually about 7 coronaviruses that we know about. This is the latest iteration of these coronaviruses. It's a highly, highly infectious virus, and it's probably one of the trickiest viruses that has roamed the earth. I say that because we go back to MERS and SARS and even Ebola, these infectious agents often were most infectious when people were manifesting the disease. And so you can identify the folks who have the disease and you can quarantine them. This COVID-19 virus is infectious even among silent carriers when people aren't exhibiting any symptoms of the disease. And so, anyone could be walking around interacting normally without any symptoms at all and can be spreading the virus. This virus ravages the body like nothing I've ever seen before. With a lot of, with SARS, for example, SARS caused a very severe respiratory distress syndrome. Initially, we thought that COVID was going to manifest itself in similar ways, but now we've seen it affect every part of the body. It causes this massive inflammatory syndrome. It certainly attacks the lungs, and that's often the cause of death and physical debilitation. But it can also cause heart attacks. It can cause strokes. It's so vicious and effective at killing. But there are things that we can do to push back, even before the vaccine. And we're all hopeful that we will see a vaccine, hopefully within the next 18 months. I think it's unrealistic to think that we're going to see it this fall. Vaccines generally take a lot longer to develop. When COVID hit New York City, we were literally overwhelmed in our emergency rooms to the extent that they had neurologists like me running COVID units in the hospital. Traditionally, that would be left to infectious disease and medical folks, but they pulled all of us in because we were overwhelmed by the number of cases that we were seeing. Our emergency departments were full. Our bed capacity was exceeded to the extent that we had to start creating additional bed capacity. We almost quadrupled our ICU capacity by creating what we called pop-up ICUs all over the hospital. We redeployed residents and surgeons and staff from different specialties to work in COVID units. I was responsible for running the COVID unit. It was even more difficult for me as a physician because I had just recovered from COVID. I was sick for about 2 weeks. I had a very high fever, persistent. I was debilitated to the extent that I couldn't even take a bath for 4 days. What was scary was when I started having asthma symptoms. In my case, they checked to make sure I wasn't still shedding the virus. And then I went back to work. But I was still a little off. I was still a little wheezy. I was using my inhaler. I was still a little fatigued, but I was desperately needed on the front line. We actually had to wear 2 masks, the N95 mask and then the surgical mask over it. And then we wore a face shield, and then we wore a cap to protect our head. And then we wore a gown, a disposable gown to protect our bodies. And then we would go into these rooms, and only one doctor from the team would go into the room at the same time because we didn't want to continuously, unnecessarily re-expose each other to the virus. And the most difficult part of this was the fact that when I wore my mask, I actually had difficulty breathing because my asthma would start acting up. I would go to the bathroom and I would secretly use my inhaler. After that, I would wear my mask and then I would go into these rooms. It was very challenging for me, having just recovered from COVID, to now be treating COVID patients. But one thing that did do for me, it did make me realize how lucky I was and how fortunate I was to be on my feet, walking and being even in the blessed position to be able to care and heal these patients who were suffering still. It was the spirit of gratitude and feeling fortunate that kept driving me forward.
I was wondering if you would be willing to speak a little bit more about, we've heard Van Jones call it an epidemic within the pandemic. I was wondering if you would be willing to unpack that phraseology a little bit for someone who might be watching this and wondering, why do people keep saying that?
One of my greatest passions is health equity. And I do a lot of NIH-sponsored research in the space of health disparities, trying to bridge the gap between Blacks, Latinos, and whites, because it is a significant gap. And this gap has been with us ever since the Middle Passage. It goes back to some very fundamental injustices that have plagued American society since slaves were brought onto these shores. There's been blood spilt, there have been martyrs, and there still are martyrs today that are invisible to us, that are fighting for justice in every corner of American society. The truth is that these injustices still remain entrenched within American society. And these inequities have driven resources and resource allocation. They've driven policy. They've driven access to opportunity. You know, the reason why zip code is a greater predictor of life expectancy or lifespan than any other variable is because zip code really is a surrogate for these social determinants of health. This is the reason why we do see disproportionate burden of disease, whether it's hypertension, diabetes, obesity. Just name the disease, you'll find a greater burden within Black communities relative to white communities. And so all of these stresses that the Black people in America go through have real physiological consequences. They cause wear and tear of our bodies. They cause excess allostatic load on our bodies, which leads to chronic diseases. And these chronic diseases is what drives the excess mortality that we see among Blacks relative to whites. What we're seeing in the age of COVID-19 is merely an exacerbation of these underlying disparities. You know, someone once said, when white America catches a cold, Black America catches pneumonia. And what that is saying is that when you add an additional illness or an additional disease to a group of people that are already at the edges of disease burden, you are going to potentially cause a complete collapse of that community. We're seeing COVID-19 disproportionately affect communities of color because these are the communities that are impoverished. These are the communities that often are unable to socially distance because they're living in crowded apartments. You know, people talk about buying all these cleaning products, but if the money you have is only enough to feed you and your family, you're going to buy cleaning products or you're going to try to feed your family. The reason why COVID-19 has a free reign within communities of color, and it's the reason why we need to address and fix these structural inequities and create a more just society.
I want to show a video. So this video is going to be of a nurse who is working here in New York.
Nobody is listening. They don't care what is happening to these people. They don't. I'm literally coming here every day and watching them kill them. Some of these people are just on sedation to keep them on the vents. Nothing else. I have a lady on a tranq on a vent, and she's not even fucking cognizant. She's not even on sedation. You know what we give her every day? We give her breathing treatments, albuterol, and insulin. And that's it. That's it. We're not treating the COVID, guys. Like, for real, we're not treating the COVID. Watched an anesthesiologist place an ET tube and rush through their esophagus, and the guy choked to death on his own blood. COVID didn't place that ET tube incorrectly. And nobody cares because they're all minorities and we're in the fucking hood. You know, and that's just not okay. You know, I grew up really poor. And so I know what it's like to be, like, completely forgotten and for nobody to advocate for you.
You know, that is one person's lived experience, and I do want to honor that. But more importantly, I want to amplify the very physical reaction that that nurse has had to working in this industry. I think about the psychological damage that will be done.
We're going to see an epidemic of PTSD.
Exactly. Exactly.
My first reaction is, is the poor nurse. She's traumatized. She's in pain. She's overwhelmed. She is having difficulty coping with the experiences that she's enduring. And I think it's a combination of just the rawness of death in the age of COVID. As a physician, we've seen death in its many forms. It reminds me of what Herodotus once said. He said, when life is so burdensome, death becomes for man a sought after refuge. Imagine being in a state where you're craving death. COVID has appeared on the scene like death incarnated as a wild animal, just ripping and ravaging through society without giving us enough time to adjust or cope or even gather our thoughts. Because as you start gathering your thought over what you've just experienced or what you've just seen, another horrific scene appears, and then another, and then another. And before you know it, you're drowning in an ocean of horrific scenes, and you're gasping for air. And that's the trauma that young nurse was experiencing there. None of us would be in this profession if we didn't care, if we didn't truly feel a sense of duty, a sense of calling, a sense of destiny. Whenever we are doing what we love, which is saving people and caring for people. COVID was a whole nother situation. There was so much death at the same time. On a normal day, we lose 1 or 2 or perhaps 3 patients in a week. But with COVID, we were losing dozens a day. And we have never been in this situation. It's quite literally as if we were on a battlefield. And this is why it's been so traumatic.
I wanna try to pivot briefly to talking about say that type of battle to another type of battle, which is say battle rap or or hip hop. You've started a nonprofit organization with the legend Dougie Fresh.
Doug and I have actually become very close friends. He's probably one of my closest friends. I wanted to develop programs and health communication programs within communities of color around stroke at the time, because too many people were dying of stroke. This was back in 2006, and stroke has a treatment that needs to be given within 4.5 hours intravenously. No one was coming in, and when people did come in, they came in too late. We have to communicate this need to come in within 4.5 hours. At the time, it was within 3 hours. And the reason why people didn't recognize that the symptoms that they were having were strokes, and people had the sense of nihilism. If I go to the hospital, what's anyone going to do? They didn't know that the symptoms and signs of stroke can be reversed with this medication that came on the market. And so I got together with Doug. Before I got together, I called his manager and I said, "Hey, Mary, I'm trying to meet Doug." And she said, "Okay, what about?" I said, "Well, I have this stroke program and I want him to write raps about stroke, and I want him to work with me in creating this health communication program for stroke." And she said to me, "So what's your budget? Sounds interesting." I said, "I don't have a budget." And she goes,
You
"Well,
mean NIH didn't want to fund that?
no, this is pre-NIH.
Come on, Fauci, come
This is
on.
before NIH." And she goes, "Well, call me back when you have a budget." And so I didn't have a budget, but I knew it was really important. So I kept calling for 6 months straight, literally just harassing Mary. And I said, just 15 minutes of his time. That's all I need. Eventually she caved. And then I met up with Doug at the juice bar on 125th Street. And he came in. I couldn't believe that he was there. And this is an iconic legend. And it was an interesting first meeting. We did connect. And then Doug called me and said he was going to work with me. And I remember when he told me that over the phone, when he called me later over the phone, I remember putting the phone down and I was like, yes.
Wow.
It just shows how big his heart was, that he was moved by me, and he felt a strong sense of connection. We just became really good friends, and he helped me write our very first song at the time, which was called Stroke Ain't No Joke. which really tackled some of the issues I was concerned about with regards to stroke recognition and coming in within 3 hours. And that was a really huge success, to the extent that the NIH decided to fund it. And so one thing led to another, and we ended up building Hip Hop Public Health together. Even now that, we have our 20 seconds or more song for the COVID pandemic, the hand washing song that we have, it's been doing really well. It has over 100 million impressions. It's been streamed millions of times just within the last month.
I'm thinking, we have so many bright young people of color who might be interested in going into medicine or healthcare or nonprofit, all area or academia, all areas that you've navigated effortlessly. What encouraging words would you have to them as they embark on their journey?
For me, it's just it's been about staying true to who you are. Be yourself. People don't realize that sometimes it's hard to be yourself when you're surrounded by a lot of people who are not like you, who don't look like you, who don't share your dreams, share your experiences. It's tempting to try to fit in with those people. But I've always believed that it is our differences that make us great, not our similarities. And I truly believe that it's important to know yourself so that you can really be yourself. The problem is that a lot of people don't spend enough time looking inwards and getting to know themselves. They spend far too much of it looking outwards and getting to know things outside of themselves. My second advice is you have to follow your passion. You have to pursue what you love and what you're passionate about. But a lot of people don't even know what that is because they don't know themselves. They don't know who they are. But once you know yourself, you'll know what you like, and what you truly love. Don't pursue someone else's dream. Pursue your dream. Pursuing a dream it's not a destination, it's a journey. That journey is fueled by passion. Passion is the fuel. That's the engine oil that's going to power you through that journey of your dream. And the other thing is to always remain humble. I think pride and arrogance and a sense of accomplishment, I think those things can be blinding. But if you reduce yourself to the state of humility, then you have the much bigger vantage point through which you can truly visualize the world and in all its splendor and all its beauty, and recognize that it would be foolish for you to even be arrogant. You can have all the gold in the world, all the money in the world. And I've seen the wealthiest patients, kings and queens, and I sit by their bedside and I listen to them, and their lives are riddled with regret. And the reason why is because they realize at the end of their journey that they were pursuing the wrong thing. It's important to give because it's in the act of giving that we receive the right things that we actually need. And so I think a life of service is critically important because I think it's through that act of giving of yourself do we receive and do we feel complete. And try to have fun, and try to enjoy your life and try to realize that every moment you're alive is a moment to feel grateful. And so also try to enjoy yourself. But that all begins by knowing yourself.
On that note, Dr. Williams, thank you so much for coming on today. It has been a pleasure getting to know more about you and getting to know more about your work. Whoever sees this really listens to what you were able to share today, because I think your wisdom and your knowledge and your encouragement is going to be the light that's going to help us all through this dark time. So thank you again so much for coming.
Thank you.
You just saw my interview with Dr. Olajide Williams, neurologist, world renowned for his work. Nothing but gems, the entire interview. So I'm just so incredibly impressed and so lucky that I had him on the show. And hopefully you all enjoyed that.
Alone. Stoplights could be murder. Movements could be murder. Conversations be murder. Oh, promise me I'll be alive when I leave my home. Promise me I'll be alive when I drive alone. Stoplights could be murder, movements could be murder. Steel bars and they put a charge on my name. Now I think they got me back in chains. If I die before you wake, I need you to know that I was looking forward to my new job tomorrow. But these lights my life may take, when I'm on the road back, I can't stand aside.